The pharmacies across the region face major concerns about pharmacy benefit managers. Pharmacists say PBMs have made it to where they are actually losing on prescriptions, paying out of their own pocket.
Pharmacies across Alabama are asking lawmakers for help and are even talking about potential walkouts. Our Anthony Jenkins Jr. tells us more about the issue.
Pharmacy benefit managers, also known as PBMs, offer ways for health insurance companies to manage prescription drug costs. This makes it so pharmacies and other drug manufacturers have access to provide medicine for patients. Pharmacist Sam Durham says recently PBMs has significantly increased the cost of medicine, making it more difficult for pharmacies to get medication.
Patients have to be able to afford their medicine. And so this is creating a problem because you have an entity that is forcing the cost of medicine to go up. And when you're involved in 25% of the expenses of our country, and you're involved in it, and then you're causing price increases, then that's really making it hard on the patients.
Originally, PBMs were designed to help reduce the price of prescription drugs, but the steep increase in costs put hundreds of pharmacies in a bind. Pharmacist Susan Ray Durham says more pharmacies are more likely to shut down and create pharmacy deserts in rural areas.
Or say if you need an antibiotic, you get a really bad cold and you have to have that prescription today. When all the pharmacies are gone, then people are going to have to really travel to a bigger city. And especially the old people, it really hurts them because many of them can't drive any longer.
Some pharmacies in Alabama have staged walkouts and are talking to state lawmakers.
No one has any power to do anything with them. It's hard for the physicians to get the changes and things that they need to get the right drug to the right patient. It's hard for patients because they're being forced to pay more money, and what's their choice? Either they can not take that insurance, but we all know most of us are tied to where we work or tied to a program that we belong to. So it's hard to change insurances.
In Vernon, telling your story, Anthony Jenkins Jr., WCBI News.
The Alabama Pharmacy Association reports more than 100 pharmacies in the state have participated in a walkout for a PBM reform.